Thank you, sir, for the opportunity. Uh, the topic allotted is about common mistakes in taking consent in ophthalmic practice affecting judgments. I think consent is the important thing. Few things like when it is to be taken, how it is taken, and why it is taken. So when it is very important, some people say it was taken so early that we were not prepared. And some people say that it is taken so late that just half an hour before the operation. In that case, we can give that consent form to the patient and relatives when the patient comes to finalize the date. Ask the patient to come with the consent, and at the time of surgery also, just before the surgery, you can take one more signature. So it is not that late and it is not that early. So both the options are covered. How it is taken? So proper signature with witness, and what sir has said that it is not the blank consent. Like proper procedure related consents are prepared by AIOS in local languages also, like Marathi, Bengali. Those consents definitely can use. Why it is taken? Because for medical legal litigations are to be avoided. So necessity of the procedure, you must explain to the patient and relatives. You must tell them what are the alternatives available and what is the end result of your procedure. Suppose it is enucleation or evisceration. After the procedure, patient is not able to see. But then after few months or few years, when some relatives tell him, he comes to you, doctor, the operation is done, but I cannot see. But if you have explained the patient beforehand why the evisceration and enucleation was done, probably visual gain is not expected by patient and relatives. Then the cost of that particular surgery, in case of IELTS and all that, there should be transparency in your communication. So comparative costs must be told to the patient, what type of surgery you are doing, what type of IOL you are putting, and what are the charges. So that transparency definitely helps you. That is one important thing you must remember: promise less and deliver more. Most of the times patients are being told that after the surgery, within 5-10 minutes you will be able to drive your own car and go home. See, these fantasy like things you shouldn't promise. So promise less, but if the delivery is a little more, patients are more happy. So branded is costing more, that's the thing people remember. Suppose Nike shoes are there, those are costing more as compared to routine shoe. So that way, if the branding of that IOL is international, probably they will pay you more. Then general and non-branded, they are costing less. So in that particular sense, they understand and then remember. About guarded prognosis, I have said enucleation, evisceration. About the gain of the vision, if you have told everything properly to the patient and relatives, they will accept. About fantasy, I have explained just now. Multifocals, you have to assess the patient properly, whether that particular patient is capable of handling all those little bit complications or side effects of multifocals if they are there. And cosmetic appearance is also very important after the end of the surgery and at the time of follow-up. Even if the visual gain is good, cosmetic appearance, the patients and relatives, they are worried about. So for counseling, it has to be done in front of patient, family and relatives. Suppose you are doing counseling only in front of patient, afterwards the family members and relatives may say that they were not explained everything. So it is better to involve few of them at the time of counseling and taking the consent. So counseling can be done, consent can be done in question answer session format. Ready modules are available. You can give them printed booklets like glaucoma booklet, cataract booklet, squint booklet, IL booklet. You can put those things, explanatory thing about that procedure on websites. Even videos can be shown to the patients and relatives what type of surgery you are going to do. Recording of that particular consent, if it's done, basically, if it is quite safe for you and your hospital. Documentation is the thing which saves you in the court of law. So documentation is must. Whatever is documented is done. Whatever is not documented is not done. So even if you have done good thing and not documented, well, it is not accepted in the court of law. So be careful. If it is CCTV recording you have done in a proper way, probably it also saves you in court of law, and from medical legal litigations you are saved. This thing about the consent, Dr. Deshpande sir has already covered. So I am not going to into details like competent person, major and guardian. In case of child 7 to 12 years, it is the gray area. 2 witnesses are must. It must be simple, any language, patient's language, that must be specific, clear, unambiguous. Mention common complications and alternatives. Don't hesitate to tell complications to the patients and relatives. In emergency like situation also, don't prohibit from taking consent. In case of evisceration and enucleation, it is must to have second opinion, and the second doctor must be patient's and relative choice, not of your own choice. So about details of consent, written consent, implied consent, Dr. Deshpande sir has already explained about this. Doctor should not feel shy of informing and taking written statement. Even if there is refusal, sometimes patients and relatives, they refuse about the consent. Again, you have to boldly document the non-compliance of any of your advice. You can write that this advice was given to the patient and relatives and they haven't accepted, and take patient's signature on that particular document. In case of refusal, don't proceed for the procedure. You may postpone the surgery or you may cancel the surgery if the consent is not given by the patients and relatives. So consent of a child after 7 years, sometimes it is 12 years is a must along with guardians. So guardian must sign. So there is no such law as consent is a must, but MCI has given the guidelines. Implied consent can be constructed by the history. However, judgments from SC and National Consumer Forum stress the need of the consent. So I think with these words about Samira Kohli and Prabha Manchanda is the case which was reported in the court of law. The judgment in Samira Kohli's case held that doctors who performed a hysterectomy and bilateral salpingo-oophorectomy under anesthesia were liable after the patient's mother had consented. But patient was not knowing. Afterwards, patient said, I was under anesthesia. Why you have removed my ovaries? So the patient claimed the operation was not life-saving and consented to diagnostic laparoscopy only. So in that case, the hospital and doctor was punished. So blank and printed about general consents, Deshpande sir has already explained. On your consent, date is a must and it must be case and procedure specific.